hydroceles, perfectly harmless or something that's really quite annoying? I'm Gareth, I'm from The Wild Sage, I'm a consultant medical herbalist, and today we're going to be giving some much needed attention to a condition that actually not many people know. It's hydroceles and what they are and how to support your recovery naturally, and also when it's time to go and see a healthcare professional. So what exactly is a hydrocele? Well, hydro, water, it's a fluid buildup in and around one or both testicles, leading to noticeable swelling in the scrotum. Ouch. It's actually usually painless and harmless, but it can cause discomfort and certainly can cause embarrassment if it gets too large. Why does it happen? Well, it will develop from birth in babies, short term, but it can also happen later in life to adults and to teenagers. That can be due to injury, infection, inflammation, or sometimes with no clear cause. And the fluid seems to collect in the thin sheath in and around the testicle, often because the body is not draining it away properly. Now, when should you seek medical advice? Well, if you have a baby and the swelling persists beyond 1 year or increases, then it's worth getting checked out again. If you have had an injury, so this is sudden pain and swelling after a trauma, then you may need urgent medical attention. It could be a testicular torsion and certainly not something to be messed with because it's an emergency and may require surgery. If you're an adult with a new, persistent or worsening swelling with pain or any changes in the scrotum, then you should be getting checked out professionally. It's really important not to self-diagnose. Professional assessment is always safest, even if it is just a little bit embarrassing. Now, there are home remedies and natural remedies for this, most of them from Indian or Ayurvedic culture. And I'm not entirely sure why Western medical herbalists haven't really got on top of this one. So I just want to talk about what you can do from home, and especially if it's mild discomfort or the early symptoms of a hydrocele. So these are traditional supportive approaches, not cures, but ways to alleviate the symptoms. And actually, hydroceles have quite a good tendency to heal themselves. So it's just about encouraging that natural healing process. First and foremost, let me look at diet. So eat lots of fruit, apples, oranges, peaches, pineapples, grapes, anything to help you feel lighter, and avoid canned fruit and any preservatives that are in them. Try and eat as much boiled vegetables or fresh salads as you can to relieve the heaviness and the discomfort. You might want to consider an Epsom salt bath. This is full of magnesium, and you add about 2 to 3 cups of Epsom salt to a warm bath and you soak in it for 15 to 20 minutes to help relax the muscles, promote circulation, and aid fluid drainage. There's a wonderful term in herbal medicine called a poultice or fomentation. So a poultice is a soft, moist mass of plant material like herbs, spices, or roots that are applied directly to the skin to draw out fluid, reduce swelling, or soothe irritation. And then fomentation is a cloth that is soaked in a warm herbal infusion and applied to the area for warmth and for the herbal medicine benefits. Now, an example of this might be a paste of black pepper or long pepper and cumin, which you can infuse in warm water and then apply that as either a paste or a fomentation to the scrotum for a few minutes and then wash it off with warm water, just not too warm. You could also consider something like a ginger tea or black tea. Both are anti-inflammatory, and the ginger is quite good at moving the heat to the peripheries to try and help clear the area. It's warm and it's drying. You could consider something like aloe vera and amla juice. This is a mix of aloe vera and amla, and it can be taken on an empty stomach to help reduce irritation and swelling. It's a wonderful term called a scrotal support. This is supportive underwear, or scrotal support could be just raising the testicles up. You may want to try elevating the scrotum. This is resting with a cushion or a towel under the testicles to improve blood flow and to reduce fluid buildup. And you could try something like ice packs for 15 to 20 minutes to ease the swelling or the pain. Now, do wrap the ice in a cloth, never apply it directly to the skin. When it comes to lifestyle advice, then avoid heavy lifting, stay active, and try gentle movement like Tai Chi for symptom relief, and always under the supervision if you are new to Tai Chi. Now, stay hydrated. The temptation, if you know that it's fluid in and around the testicles, you try to abstain from any water, any fluid, but actually you want to drink plenty of water and fluid to get things moving. When it comes to Western herbal supports, then there's a few herbs that are worth mentioning here. So this is calendula, marigold, which is used for tissue healing and swelling, and it can be made into a topical cream or used in teas. There is cleavers, otherwise known as sticky willy, which is a wonderful lymphatic tonic, and it helps support fluid movement and reduce swelling, and that can be taken as a tea or infused in water. Horse chestnut improves the venous tone and reduces edema and the swelling in and around the testicles, so that actually might be used topically or indeed internally. And you could consider something like Centella asiatica or gotu kola, which supports the connective tissues and the microcirculation all around the body, but certainly in and around the testicles. In Chinese medicine, there is a herb called dong quai. This is Angelica sinensis, and it's traditionally used for circulation and inflammation. It may help with the fluid retention and tissue healing. We mentioned ginger earlier, but you could use ginger with turmeric as a strong anti-inflammatory and add those to the diet or enjoy them as teas. And dandelion, the wonderful diuretic and anti-inflammatory herb. Dandelion is really useful to try and get rid of excess fluid that is built up in your system. Now, these remedies are supportive. It's not a substitute for medical treatment. If your hydrocele is large, if it's persistent or causing trouble, if it's severe or recurring, then you may need to go and see a professional and you may need surgical intervention. Do consult with a medical herbalist or your doctor before starting any new treatment or if your symptoms change. So that's the lowdown on hydroceles, what they are, how you support them naturally, and when to seek medical advice. If you have any questions, if you want any tailored advice, leave a comment or reach out to me at thewildsage.co.uk. Men's health matters. It's worth talking about. And if you like the content here in this video, then please do like and subscribe to the channel. Cheers. Until next time.